Hi, and welcome to video 8 of the informational video webinar series on the rules for certified school-age childcare centers. In this video, we are covering the following: facility structure, water supply and plumbing, toilets and sinks, and hand washing. My name is Christina Christian. I work for the Office of Child Care as a regional manager in the Tualatin Field Office. The Office of Child Care hopes that you find these videos informative and supportive in learning about the new school-age certified child care rule set. During each video in the series, we will explain some of the key features and highlights of the school-age center rules. Another new aspect is that the rules have been organized differently to help make information easier to find. While we are highlighting many key features, changes, and new rules throughout this video series, the entire rule set will not be reviewed. Please refer to the School-Age Center Rulebook for the full list of requirements and rules. Okay, let's get started. Facility structure. Facility structure. There are several rules around facility structure to help ensure the safety and well-being of children in care. We will review a few of the key ones in this video. There are additional rules on facility structure that will not be covered. Be sure to read all of the requirements in the School Age Only Rulebook. Accessibility and safety. A school-age center must ensure that children do not have access to the following: heating equipment such as furnaces, fireplaces, stoves, steam and hot water pipes, and electric space heaters, or to cooling equipment such as air conditioner compressors. A school-age center's heating equipment must be safe to operate. Heating and ventilation. A school-age center must have adequate heating and ventilation to maintain the indoor temperature no lower than 68 degrees Fahrenheit and no higher than 85 degrees Fahrenheit when children are present. If the center is unable to maintain an internal temperature between 68 and 85 degrees, a school-age center must utilize strategies to help children stay warm or cool. A school-age center must ensure that all rooms, including the kitchen and restrooms, have enough ventilation to keep them free from excessive heat, condensation, smoke, fumes, and unpleasant odors. Lighting. Lighting levels must be bright enough for comfort, safety, and adequate supervision. Light fixtures must be equipped with covers, shields, or shatter-resistant bulbs. Heating safety. Open flame, unvented, and vent-free gas or oil heaters, generators, and portable fuel-burning space heaters are prohibited while children are in care. Portable electric space heaters must be attended while in use and be off when unattended, have an automatic shutoff feature for tipping over and overheating, be placed only on the floor, and be used according to the manufacturer's instructions. Fireplaces, fireplace inserts, and wood or corn pellet stoves, if used, must have a secure, stable, protective safety screen, be installed in accordance with the local or regional building code and the manufacturer's installation instructions, and be inspected and cleaned annually. Flammable materials. Flammable materials, including papers, curtains, and furniture, must be at least 3 feet from furnaces, fireplaces, or other heating devices. Additional facility structure points. After painting or laying carpet, the building must be aired out completely for at least 24 hours with good ventilation before children can return. The electrical system must not pose a risk to children. All septic systems must meet the requirements of the Department of Environmental Quality. Floor surfaces must be easily cleanable and free of broken or loose tile, large or unsealed cracks, splinters, torn carpet or vinyl, and holes. Carpet must not be used in food preparation areas and restrooms. Water supply and plumbing. Water supply. Having safe and clean drinking water available for children is important for their health and well-being. A school-age center has requirements for ensuring that the water is safe and clean for children to consume and for any cooking during food preparation. Water supply requirements. Water supply must be from a public water supply, and the center must test each faucet used for drinking or food preparation for lead in the water, unless the school-age center uses an Office of Child Care approved alternative water source. An example of an approved alternative water source is bottled water that is supplied by the facility, or the program can have bottled water service. If the water supply does not meet applicable levels, the faucet must not be used for consumption or food preparation until the lead levels have been corrected. Interrupted service or contaminated water? A school-age center must notify the Office of Child Care and all families when the water supply is interrupted for more than 1 hour and or the water source becomes contaminated. Record keeping and posting requirements. A school-age center must keep a copy of the most recent lead test results on site at all times. Immediately upon receipt, a school-age center must have the most recent lead test results summary letter provided by the Office of Child Care available for families and the public to view in a prominent and frequently visited location. Toilets and sinks. Cleanable surfaces. A school-age center must provide smooth, washable, easy to clean walls and floors in the toileting and hand washing areas. Toilet requirements. A school-age center must provide toilets that are supplied with toilet paper, provide privacy such as being screened, equipped with doors, or having children take turns while supervision is maintained, and if equipped with doors, they must be able to be unlocked from the outside. This might require an opening device which would need to be readily accessible to staff. Hand washing sink requirements. A school-age center must have hand washing sinks that have hot and cold running water unless the center's program is in a public school building, have water that does not exceed 120 degrees Fahrenheit, have liquid soap and paper towels within easy reach of children and dispensed in a sanitary manner with a trash container, are not used for preparation of food or drinks, dishwashing, rinsing soiled clothing, cleaning equipment that is used for toileting, or for the disposal of any wastewater used in cleaning the center. An alternative option for a hand washing sink. When plumbing is unavailable to provide a hand washing sink, the center may provide a hand washing sink using a portable water supply and a sanitary catch system with a written plan approved by a local public health department. A mechanism must be in place to prevent children from gaining access to soiled water or more than one child from washing in the same water. Hand washing. When to wash hands. Staff and children must wash their hands with soap and warm running water after using the toilet, after assisting someone with toileting, before handling food, and before and after eating. Hand washing or hand sanitizer. Staff and children must either wash their hands with soap and warm running water or use hand sanitizer with an alcohol content between 60 to 95% after wiping their nose, after coughing or sneezing, when arriving at the center, after outside activities, and after handling pet toys or touching animals other than dogs or cats. Alternate settings. When hand washing is not possible but required, for example on field trips and on the playground, moist towelettes and hand sanitizer with an alcohol content between 60 to 95% must be used together. Specific needs. For children with special needs who are not able to wash their own hands, staff may wash children's hands with a single-use cloth rather than under running water. Thank you for watching. You can now move on to video 9 in the series.